I'm Dr. Robert Constant. I'm a clinical endocrinologist. I work at the Diabetes and Endocrine Center in Orlando, Florida. One of my areas of interest is in thyroid management. I'll tell patients that when I view somebody with thyroid disease, I typically look at their thyroid disease in three different spheres. The first is anatomic issues, and by that I mean is the thyroid a normal size, or is it enlarged? If it is enlarged, is it nodular or diffusely enlarged? And there are issues about nodules when you see them that we may need to deal with. And so one principal area that I'm interested in working with people about is in the anatomic abnormalities of the thyroid and what implications that might have about their clinical history and their management. The next area is functional issues. The thyroid doesn't have to look pretty, but it does have to function normally for them to be and maintain good health. And in that instance, we're looking at usually biochemical testing with blood tests. And based on those tests, we can find out if the thyroid is overfunctioning or if it's underfunctioning, and make appropriate inferences about what we should do about that. So looking at somebody's functional characteristics is an important aspect that we need to deal with when we consider thyroid disease. The third and the last area that we look at is etiology. In other words, sometimes it's very important to ask the question, well, why do you have this thyroid disease? If you've got nodules, or if you have an underfunctioning thyroid or an overfunctioning thyroid, why is it that way? That's not just an academic question, it's a clinically important question, because very often what we recommend to the patient and how we end up managing them will be varied depending on what the underlying cause is. And so we spend a lot of time trying to make sure that we understand the etiology or the underlying mechanisms by which they have a thyroid abnormality.